Hi, this is Dr. Martin Rutherford, and this week we're going to talk about one of my favorite subjects, and that is fibromyalgia. But we have a lot of content online on fibromyalgia at powerhealthtalk.com if you're interested. We have hours of content, and I'm going to review some of it. But we're going to start catching up on updating a lot of the content that we have online already. And the latest, I believe, data that I have embraced, that I've come to understand is involved in a lot of fibromyalgia cases is brain trauma, traumatic brain injuries, post-concussion syndrome. We've talked about PTSD at length in the past on the previous presentations that we've done. We've talked about emotional traumas. But the traumatic brain injury is something that I must admit, even though I have a mentor that has talked about it for a while, I just didn't completely embrace it until just recently, and that's because I've had several people come in. I've gone through histories with them, found out that they had this history of sometimes multiple traumatic brain injuries, and then saw how they played into the fibromyalgia, and I thought this was a good topic to share. So fibromyalgia, kind of a power health recap of fibromyalgia. Again, I was started out in functional medicine. I think it's fair to say I was one of the first functional medicine doctors in the pool, seemingly light years ago. And we all started out with fibromyalgia because that was it. Back in the 90s, it was CFIDS, chronic fatigue immunodeficiency disease. And fibromyalgia and chronic fatigue are kind of frick and frack, kind of Siamese twins. And it seemed like that was the right place to start, and we learned a lot. And what we ultimately learned over the years was that we started out with kind of a feeling and an understanding that fibromyalgia usually had an autoimmune component to it. Could be a multiple autoimmune component, could be just a single autoimmune component. It seemed like to me, it seemed like every time, but I'm sure this is not the case. It seemed like most of the time that the one autoimmune component that was always there was an immune attack against the thyroid, which was Hashimoto's. Hashimoto's is it's an immune attack against the thyroid, and it has an amazing number of variations. But if the person is having that particular clinical entity, there's like 20 symptoms that go with that, and a lot of them are fibromyalgia symptoms. And I'm fatigued, and I put on weight, my joints hurt, and my hair is falling out. And every time, and the inflammation comes and goes, and my joint pain comes and goes, and a lot of that can be part of the Hashimoto's contribution. Then there's usually a gut problem. The various entities now that discuss intestinal problems is pretty humongous. There's just a ton of data out there on it. And at the time, but that was kind of a breakthrough. Most fibromyalgia patients have leaky gut. They have food sensitivities. These can flare things up. They can flare up autoimmunity. And a lot of them have irritable bowel syndrome. A lot of fibro cases have irritable bowel syndrome, which leads to the next entity that we usually see, which is brain, and we've discussed it as brain stress. We've discussed it as emotional trauma, PTSD, chronic fight-flight. Today we're going to add something to that, and those types of conditions tend to affect pretty much every cell and every type of physiology in your body. They definitely affect your gut, and then that affects your leaky gut, helps one of the things that cause leaky gut, and then that can perpetuate into bacterial endotoxins getting out of your gut and creating immune inflammation. So this is why fibromyalgia was so complex. There are other components that we've talked about. We talked about non-length dependent peripheral neuropathy, where a lot of people, as many of you know, I've been through this fibromyalgia, peripheral neuropathy issue. And so I know myself, when the fibromyalgia started, pain started to clear up, I still had numbness, very significant sensitivity in my feet from like the shins down. So I had peripheral neuropathy. Well, we now know that that's a separate entity. It felt like it was all the same, right? But it's a separate entity. So we started to realize that not only was that entity separate, but that non-length dependent peripheral neuropathy was a generator of the peripheral neuropathy pain that took place throughout the body. And then we've talked about, and there's presentations again on every single one of these subjects on powerhealthtalk.com. And so then we talked about how fibromyalgia is a central pain syndrome. That basically what happens is central nervous system is your brain and your spinal cord. And so the pain overwhelms your brain stem at the base of your at the top of your spinal cord and at the base of your brain, and that's where the filtering mechanisms are to filter out pain. And they're already weakened in the fibro patient because the fibro patient is already stressed out of their mind, and that stress response actually overwhelms the relaxation response in a place called the brain stem. And that happens to be in the same place where the mechanism to filter out pain is. So it's weakened, the pain overwhelms it, and now your brain actually starts to learn the pain. So as time goes on, we keep finding out more and more and more about this mystery disease, fibromyalgia, that many of you have been diagnosed with and have been told it's in your head and you need to go to a counselor and you just need to like lighten up and you just need to like relax. And we're finding out that it's a little bit more than that. So today, I'm going to spend the next just few minutes talking about brain trauma. Now, for those of you who watched us for many years, and I appreciate your interest in what we have to say. And most of you know I have a lot of this stuff. So I've had a lot of concussions, but I've had 3 particular ones that I lost conscious, and 2 of them were kind of game changers in my life. One of them was in a college game where I was a soccer player and I got kicked in the head and I was out for about 20 minutes. And then it really affected my whole life for what I thought was about the next 6 months to a year. And because it was very obvious, I lost the ability to think. I had to quit school for 6 months. I had to change majors from a math-oriented major, an engineering major, to a major where I just read, like a philosophy and English major, which obviously I was able to get past eventually, but nothing against philosophy and English majors. But the point being, one part of my brain really got racked up. And so so about a year later, I had amnesia, short-term amnesia, I had migraines. But about a year later, I felt like I was okay. But in the end, I wasn't. And a lot of the subtle symptoms that I had been experiencing throughout the years, I only recently understood how much they all went back to the traumatic brain injury. And how much that had contributed to the difficulties I was having as I was going through the fibromyalgia, and that it was a component. So how does mild traumatic brain injury or severe traumatic brain injury or post-concussion syndrome fit into this? It's going to make total sense to you when I explain this. You're going to kind of go, duh. But this is how it works. So we have a system in our brain. We have a separate immune system in our brain. So let's say our brain has like 1 trillion brain cells. I forget how many, but it's a lot. And for each one of those, now I've seen tremendous variations of estimations of what I'm about to say. Most recently, about 2 weekends ago, I read that there was 100 immune cells for each one of these brain cells that we have. A brain cell's called the neuron. I've read 10, I read 100, I've read 50. It's a lot. These cells are called microglia, And they're kind of interesting. When they're doing their job, it's like this freaky little thing where they're like little Pac-Men that are going all throughout your brain as you're sitting there. It's pretty wild. And they're chewing up debris, and they're chewing up used up proteins, and that's their job. And their job is just to kind of keep eye on everything, and it's a completely separate immune system from the rest of your body. There's something called a blood-brain barrier. So it's in the veins and arteries in your brain. It's in the blood vessels in your brain, and that blood-brain barrier keeps a lot of things out of your brain that don't need to be there. What does it let through? It lets glucose through. It lets oxygen through. It lets essential fatty acids through. And certain neurotransmitters it'll allow through, but not much more. There's not a lot of things that nature wants in our head, in our brain. And so this blood-brain barrier is when you get a concussion, particularly if you've lost consciousness, this blood-brain barrier can be compromised. Now, just for, and I have presentations on traumatic brain injury on powerhealthtalk.com. So when we talk about how when you get a traumatic brain injury, only maybe 15% of the people actually have symptoms that go on and on and on. But here's the thing. The symptoms that they were talking about back when we did that report are the symptoms that I was talking about that I thought were gone after a year. So I suspect, and the data was that was about 15% of the people who got brain trauma, but there's strong implications now that it's far more than that. And you've seen the data, or you're probably aware of the data that is coming out relative to the professional football players, and that is no joke. That is like a very for real thing. In fact, it's probably way worse than it's even come out to be at this point in time. So we have this situation where we get hit in the head, we lose consciousness, or maybe we don't even lose consciousness. Maybe we just get dinged around and we're walking around for a month forgetting where our keys are and forgetting the words and stuff like that. So we have an injury. We have an injury to the neurons themselves. So those neurons that get injured, they're not coming back. So you lose aspects of that. But that's not contributing to the fibromyalgia. What's contributing to the fibromyalgia is those little microglial things. They now go into overdrive to try to dampen the inflammation that comes along with that trauma to the brain. Now, it's kind of an interesting thing because once they get wound up and get going, they actually ultimately become a source of inflammation in and of themselves. Worse yet, they have other things that they do other than just go around like little Pac-Man and chew things up. They help you to create something like neuroplasticity. So these little microglial create the ability to do things. So for example, let's say you're playing a piano. Let's say you're learning to play a piano. And I don't know how much of me you can see here, but let's say you're playing a piano and you're playing it with like two little fingers, right? Chopsticks. I don't know how many people still know what chopsticks is. Dun, 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 dun. So basically, you're using this part of your brain. Like, and I mean like right where my fingers are, okay? Now, if you move on to a little bit more complex stuff, like from my day, in that day, it would have been like playing a Beatles song, which frankly are very simple chords until they got going later on. That like simple chords are like chords from like the 30s or 40s, so like a Frank Sinatra song or a pop song. They're very simple chords, but more complex than two fingers. Your brain now starts to recruit other neurons to help the more complex aspects of this. And if you happen to advance to like Tchaikovsky or Mozart or Bach, literally this much of your brain starts being recruited to be able to help your fingers to make these complex moves. That's called neuroplasticity. Without good microglial function, that doesn't happen, or it doesn't happen very well, or it's very difficult to learn these types of things or recruit these types of healthy neurons, which again is called neuroplasticity. the microglia do so many things. They help to establish good blood flow and heal the inside of the arteries in the brain. And they affect something called growth factor. So that growth factor in your brain helps you to reestablish new, healthier tissues in there, but it also creates that neuroplasticity. So anyway, when these microglia are busy trying to dampen inflammation, they're not doing their other job. They're not doing the neuroplasticity job. They're not helping you to heal. Now, one more thing that happens when you get a traumatic brain injury and your blood-brain barrier breaks, okay? Again, the blood-brain barrier is designed to keep bad things out of there, but it's also designed to just keep large proteins out of there. It just wants a clean environment. It just wants oxygen, your brain. It wants blood sugar. It wants essential fatty acids, and it wants an absence of inflammation. Well, now, when the blood-brain barrier breaks, many of those things can get through up there where they don't belong, creating a bigger demand on these microglia. More, and even worse, and this is going to sound good, but it's not, okay, even worse, the immune system that regulates the rest of your system, which has been separated by this blood-brain barrier, now goes into there. Now your microglia are like going crazy. And this is called microglial priming. And basically, once you get microglial priming, you have a problem. If you can have like brain fog and have a very simple case of brain fog, and you can have fibromyalgia and think you're absolutely dying, and go get on a diet, and let's say you get on the autoimmune paleo diet, okay, which is a popular one, and everything goes away, and you go, oh my God, like I have to tell everybody in the world about this because this is a miracle. I have found the cure to fibromyalgia. And I'm making fun of some of you out there who have put this on YouTube. But in essence, you have not found the cure. You just had a basic inflammatory problem. Probably had a bad gut, probably had some food sensitivities, and you didn't have any of these other things. You got on the diet, you dampened all of the inflammation, your fibromyalgia went away. Then there's a little bit more chronic inflammatory response, and that chronic inflammatory response might be there because you had more than a leaky gut. Maybe you had the Hashimoto's, maybe you had the stress response, maybe you had the Hashimoto's, the stress response, the leaky gut, and maybe you have bad blood sugar that every time it goes up or down, it creates inflammation. That affects your thyroid. And this is all on the other videos. There's literally everything I say here probably has another entire video on our Power Health Talk website. So that person has chronic issues because just getting on a diet isn't helping that person. Just getting on the diet and taking all of the supplements that you've heard about, turmeric and resveratrol and high doses of D and glutathione and nitric balance, aren't fixing that person. They might fix them a little bit more, but they're not fixing that person because you have multiple systems involved. That's a very doable case, but you usually need a little help to negotiate your way around there. Then we get into this microglial priming. This is a different animal, and because what happens is you'll usually only get the long-term effects of the concussion if you are already compromised. So if you're already compromised, in other words, if you already have an autoimmune problem, if you already have a bad gut, if you're already going through emotional trauma, if you're already going through a big stress and your physiology has been compromised, and now you get the concussion, okay? So you can tell that I've had concussions. And now you get the concussion. Now that second hit, or that hit in the person who's already compromised, that's the one that's going to set off the microglial. And it's going to prime those microglial, and they're going to stay primed forever. And so this has started, and then it's going to create inflammation. You have a bad blood-brain barrier. The inflammation is going to flare up immune responses. If you have Hashimoto's, it's going to flare that up. If you have If you have rheumatoid arthritis, it's going to flare that up. That's going to flare different things up. Some of you are going to have joint pain. Some of you are going to have, the sensitivity. Some of you are going to have the brain fog. This requires an entirely, I don't want to say separate approach, but within the framework of everything else, this becomes the major player because the brain controls what? And hopefully I heard a collective everything out there. Okay, I mean, brain controls everything. Brain is who you are. Your frontal lobe is who you are. It's how you experience life. It's how you think. It dictates your ability to work and the type of job you can do and the type of recreation you enjoy and your ability to be productive and laugh and cry and all that. That's your brain. That is your brain, and different parts of your brain do that. But your brain also controls movement. It's your brain goes, move your arm. So this is a big player in perpetuating fibromyalgia when it's there. It's not there in all of you. It's not there in all of those of you who are watching this who have fibromyalgia. Now I'm bringing this up because I was just exposed to this material just a very short time ago. And those of you who've been watching me know I've been in chronic pain and fibromyalgia and for a long time, And this was, we do functional neurology here, we do functional medicine. But this has been kind of a new understanding beyond the emotional trauma, beyond the childhood stress, beyond the PTSD-ness and the amygdala, the fight-flight response. This is a different animal. Separate from those, or if you already have those, in addition to those. That is a tough case. And we've had several of them lately. I have 3 of them going right now. And they're a little bit more of a challenge, but there is an understanding as to how to go about these. There are separate nutrients that are better for the brain than others, and if I discussed them all with you, you'd probably know the name of every one of them. But they only work under certain circumstances, and this is where the presentation is also based on having the dynamic of being able to understand functional neurology along with functional medicine, because you have to be able to know how to strengthen the neurons that are there, the brain cells that are there, in addition to getting the normal physiology under control, in addition to getting the immune physiology under control, finding out if the person has a bad blood-brain barrier. The vast majority of you, if you have a leaky gut, the vast majority of you are going to have a bad blood-brain barrier. I'm not going to get into the whole chemistry and science of that, but there are tests to tell you if you have a bad blood-brain barrier. You have to determine a 4th type of inflammation. Where is the inflammation coming from? And you have to, and there's like 4 categories of that, and one of them is neurological autoimmunity. So have you developed an immune response against the tissues in your brain now? If you've already had one to your thyroid, or you have rheumatoid arthritis, you have lupus or something like that, there's a good chance that you'll develop autoimmunity. There's testing for that. There's testing for the blood-brain barrier. If the blood-brain barrier is there, there's things that you can do to heal it. It's best if you could heal it. I happen to know my blood-brain barrier was not healed for years and years and years and years. And I'm being exposed to this material. There's special diets for this, separate from the autoimmune paleo diet, separate from allergy elimination diets, separate from just getting leaky gut under control, separate from vegetarian diets and FODMAP diets. The keto diet tends to lean in a direction of being a better diet for this type of a situation. So those of you who watch me who know that I'm a vegetarian, I'm not a vegetarian anymore, so don't fall off of your chair. But I've gone to that diet. I've started to do the exercises that are more appropriate, and these are things that have just come out, not in the too distant past. And I'm taking the nutrients that are appropriate for me, and there's ways to figure that out. If you have a bad blood-brain barrier, and and you don't get it healed, your approach is going to be different than if you have a blood-brain barrier that you can heal, and your results are going to be different. So fibromyalgia, I talked about all of the other entities that we've already established that contribute to fibromyalgia. This basically exacerbates all of them. This essentially exacerbates, if you got Hashimoto's, they had already established that the research has already established that stress was one of the causes of Hashimoto's, one of a handful of causes that we know of. And if you have small fiber neuropathy, that's nervous system, okay? And if you have bad gut, then they're calling it irritable bowel syndrome, irritable brain syndrome, that's brain. If you have central pain syndrome from the perspective that you're not blocking out pain anymore, that's brain. So this is contributing to all of the aspects of what we're coming to understand one step at a time are contributing to fibromyalgia. This is a huge breakthrough. I can't even tell you how exciting this has been for me as a clinician, because as I was learning the materials, it was just like so many things were snapping into my mind, that this difficult case and that difficult case. So, and I wasn't asking anybody if they had had a concussion, but now I am, and now I'm like in shock. Oh yeah, I've had 2 concussions. Oh yeah, I was dropped on my head on the concrete when I was 7 years old, but my mother said it wasn't really a big deal. And so how do you establish that? You can establish that through testing. You can establish that through a complete neurological test. Some new history forms have been developed that I'm in the process of using that can actually localize where the trauma is, if it's there, kind of establish whether it looks like you've had a trauma. So if you've had fibromyalgia, establish that you've had a trauma and where it is. So if you have fibromyalgia and you've done all of the things, even if you've been here and you think you could be better, more better than you left here. But if you have fibromyalgia, this is something to really look into. It may be it may be the X factor. It may be the last piece to the puzzle. I don't know. Fibromyalgia is pretty complex in a sense that there's so many systems involved and so many things that can manifest, and you getting the massive fatigue and the brain fog and all the thyroid symptoms and all the gut symptoms and all the symptoms from your food sensitivities and your blood sugar going up and down, low blood pressure, high blood pressure. It's crazy. It's seemingly crazy to think of all of the things that you have to evaluate when you're properly assessing a fibromyalgia case. And this is just one more. But I think this is like huge. I think it's a biggie. From what I've seen so far, this is going to be a game changer for us as far as treating fibromyalgia. So I hope that you feel this is good data. I share it with you from the bottom of my heart. This is like a big change for those of you who are struggling. This is one thing to really look at. And I'll probably be going into it more in more aspects in the future as I become more conversant with it. As many of you know, I basically share with you what I see, and a lot of you say you seem awfully cocksure, confident about what you're doing. And I'm not cocksure, confident about a lot of things. I can tell you that. But I know what I see. We've treated thousands and thousands and thousands of patients, so I can share with you what we find from the observations of responses to what we do. So anyway, so that's it. So that's kind of the presentation for this week. Fibromyalgia, traumatic brain injury, mild traumatic brain injury, post-concussion syndrome, all of those entities. I am certain that those of you who have fibromyalgia, if you have those, I am certain that on some level, probably varying from one person to the next, that they are contributing to your present day problems. Even if you're 65 years old and you got dropped on your head on concrete when you were 7 and your mother didn't think it was a big deal because your head didn't split open and you didn't have to go to the hospital and you didn't die overnight and all the things that they would tell you back then. So that's it. So until next week, or until my next presentation, until next week, probably, you can, if you want any more information in this, as I've said many times, you can refer to our presentations on powerhealthtalk.com. And I'm always open to suggestions for topics as well as accolades and criticisms. So until then, thanks for watching.